back to my house.
Shit, okay.
I feel it, just chilling.
Yeah.
See where it goes. I bet.
Oh shit, I think that might be her. Oh yeah, she's waiting.
Really?
Alright, bro. Hey, before you go, you gotta use one of these. Nah, bro.
Okay. Bold move.
Hey, are you out front? Alright, word, I'm coming down.
Yeah, it's crazy. That's like the 30th time this month. Shit.
I know, man. He just
Like, I can't even pull back. Let's look it up, dude. Like, Jesus, man.
left and right everywhere we go. Seems like,
Right? I've been here for like, who knows how long.
He
And
gets
that's
to use
the
some protection though. I'm down.
Dude, I know. That's,
he's about to catch something.
it's a little risky.
Not a case.
Three days later.
I don't know what happened to him.
I wonder what happened with that girl.
Yeah, seriously. I wonder how that nothing to kill with. Shit, what's up?
Whoa. What's that on your face, bro?
What happened?
It was after that chick. We were hanging out, and this happened. I don't know what's up.
Oh, you gotta
You got it checked out yet?
bro.
Yeah, you got that checked out yet
I
now?
don't think. Don't people get like that all the time?
No,
I mean, not what I
definitely
heard
not.
of.
Maybe there was something special, but I was.
I mean, we told you to wear the rubber.
Yeah, bro. But you was like, oh, nah, I don't need it.
Yeah.
Should have used it.
What is that, like 30 cents girl or something like that? Yeah, I was. It was gonna happen sooner or later.
I lost count.
Herpes is an infection caused by HSV, herpes simplex virus. This virus affects the external genitalia, anal region, and skin and other parts of the body. Herpes is a long-term condition, however, many people never have symptoms even though they're carrying the virus. Symptoms include blisters, ulcers, pain when urinating, cold sores, and vaginal discharge. Although there is no cure for herpes, it can be treated using medications and home remedies. There are two types of herpes simplex viruses. HSV1, oral herpes, or HSV2, genital herpes. More than 50% of people in the U.S. have HSV1. Around 15.5% of people in the U.S. age 40 through 14 have HSV2. Receiving oral sex from somebody who has cold sores around their mouth significantly raises the risk of becoming infected. It is also impossible to get herpes from a toilet seat. Recurrent infection symptoms are burning or tingling around genitals before blisters appear. Women may have blisters and ulceration on the cervix, cold sores around the mouth, or red blisters. A couple ways you can contract the virus is having unprotected vaginal or anal sex, having oral sex with someone who gets cold sores, sharing sex toys, and having genital contact with someone. A couple home remedies include taking painkillers, bathing in lightly salted water, soaking in a warm sitz bath, applying petroleum jelly to the infected area, avoiding tight clothing around the affected area, washing hands thoroughly, especially after touching the infected area, refraining from sexual activity until symptoms have gone. If urinating is painful, apply some cream or lotion to the urethra, for example, lidocaine. There is no drug that can get rid of the herpes virus. Doctors may prescribe an antiviral, such as acyclovir, which prevents the virus from multiplying. Antiviral medications will help the outbreak clear up faster and will also help reduce the severity of symptoms. Ways to prevent herpes. Use condoms when having sex. Do not have sex while symptoms are present. Do not kiss where there is a cold sore around the mouth, and do not have too many sexual partners. This is why herpes sucks. So wear a condom.
I don't think so.
What you looking for? Let me get one over there.
Oh shit. God, there's a towel, man. Freaking wet. Oh, thank God.
The STD known as crabs is referred to as pubic lice, whereas parasitic insects can infest in the general area of humans. These pubic lice organisms are typically spread throughout sexual contact. Rarely, infestations could be transferred through contact with the infected person's belongings such as towels or clothes. Any physical contact, including touching, may also put you at risk. Even if there's no physical or sexual contact, you may still be at risk by sleeping in a person's bed or using their blanket or wearing the infected person's clothes. Some common symptoms include lots of itching in your genital area, small bugs in your pubic hair, crab eggs known as nits on the bottom of the pubic hairs, and dark spots on the skin. With symptoms comes treatments. Decontaminating yourself, your clothes, and your bedding is a good first start. Over-the-counter lotions and shampoos such as Nix and Rid can be used to remove the crabs in your body. If left untreated, you can develop infections from scratching as well as a change of color in the skin, becoming more scarly and scarred.
Desmond, we're ready for you.
Alright, thank you.
Okay, so go ahead and tell me the symptoms.
Okay, well, it's been happening for like a week now. Basically, just when I go to the restroom, it kind of hurts in that area.
Yeah.
I don't know what's up with me, but
Right.
I just got pain in that area. It's kind of red in that area. Not too bad though, but yeah.
Okay. And then how long has this been happening for?
About a week.
About a week, okay. Well, based on your symptoms, I can tell you have chlamydia.
No.
Sorry.
How's it possible?
Have you been sexually active? That's
You
the
got
main
me there.
cause. Yeah.
You got me there.
It happens. It's normal and it's treatable, so.
Okay.
We'll
So
take care of
it's
it.
curable.
Yes, 100%.
Okay. Sure.
I can go ahead and give you some antibiotics.
Thank you.
Yeah.
So how long roughly should this take and then?
Take that for about a week or so.
Okay.
And then, if not, you can always come back and we'll get something else.
Well, doctor, thank you.
No problem.
Chlamydia is caused by bacteria called Chlamydia trachomatis. It can happen in the throat, rectum, urethra, and cervix. It is caught during intercourse or the use of sexual toys. It can cause serious damage to a woman's reproductive system. Some symptoms are pain in eyes, lower abdomen, pelvis, testicles, or vagina. Pain circumstances can occur during intercourse or during urination. Also common, spotting near pelvic area. Some treatments are antibiotics and other prescribed drugs. Ways to prevent this is wear a condom and make sure your partner is tested before having intercourse.
Oh my god. I don't know what's happening.
2 hours later.
Push. Push. Help me through this.
Wow.
It's a boy.
Excuse me, Beyonce. Congratulations on the baby, but I'm sorry. Your kid has HIV. How is this possible? He's born with it. You have HIV too. Oh my god. I'm so sorry.
A person with primary syphilis generally has a sore or sores at the original site of infection. These sores are usually but not always firm, round, and painless. Symptoms of secondary syphilis include skin rash, swollen lymph nodes, and fever. The signs and symptoms of primary and secondary syphilis can be mild and they might not be noticed. During the latent stage, there are no signs or symptoms. Lastly, tertiary syphilis is associated with severe medical problems. A doctor can usually diagnose tertiary syphilis with the help of multiple tests. It can affect the heart, brain, and other organs of the body. Most of the time, a blood test is used to test for syphilis. Some healthcare providers will diagnose syphilis by testing fluid from a syphilis sore. And yes, syphilis can be cured with the right antibiotics from your healthcare provider. However, treatment might not undo any damage that the infection has already done. Having syphilis once does not protect you from getting it again. Even after you've been successfully treated, you can still be reinfected. Only laboratory tests can confirm whether you have syphilis. Follow-up testing by your healthcare provider is recommended to make sure that your treatment was successful. It may not be obvious that a sex partner has syphilis. This is because syphilis sores can be hidden in the vagina, anus, under the foreskin of the penis, or in the mouth. Unless you know that your sex partner has been tested and treated, you may be at risk of getting syphilis again from an infected sex partner.
Okay, so the next STD is gonorrhea, and gonorrhea is an infection caused by a sexually transmitted bacterium. That bacterium is specifically called the Neisseria gonorrhoeae, and that bacteria is most often passed from one person to another during sexual contact, including oral, anal, or vaginal intercourse. So symptoms of this STD for both men and women would be painful urination. In men, you can get pus-like discharge from the tip of the penis or pain or swelling in one testicle. For women, you can have increased vaginal discharge, vaginal bleeding between periods such as after vaginal intercourse, painful intercourse, or abdominal or pelvic pain. Other parts of the body can also be affected. Your rectum can become red, you can have anal itching, and also pus-like discharge. Your eyes can become very sensitive to the light. You can have pain and pus-like discharge from one or both eyes. Your throat may also become sore, or swollen lymph nodes may appear in the neck. And if one or more joints become infected by the bacteria, the affected joints may be warm, red, swollen, and extremely painful, especially when you move that joint. Alright, so a handful of complications may come with gonorrhea. If left untreated in women, it can spread into the uterus and fallopian tubes, which causes pelvic inflammatory disease, which may result in scarring of the tubes. It causes a great risk of pregnancy complications and infertility in women, and pelvic inflammatory disease is a serious infection that does require immediate treatment. So infertility in men, if left untreated, can experience epididymitis, which is an inflammation of a small coiled tube in the rear portion of the testicles where the sperm ducts are located. And epididymitis is treatable, but if left untreated, it may lead to infertility. And you can see in the picture on the right, it's infected. On the left, it is normal. The bacterium that causes gonorrhea can spread through the bloodstream and infect other parts of your body, including your joints. Fever, rash, skin sores, joint pain, swelling, and stiffness are possible results. On the left, you can see the lip has skin sores, and on the right, the knee is very red and swollen. So having gonorrhea makes you more susceptible to infection with human immunodeficiency virus, which is HIV. That virus leads directly to AIDS, and people who have both gonorrhea and HIV are able to pass both diseases more readily to their partners, making you a very big risk. And babies who contract gonorrhea from their mothers through birth, pregnancy, labor, or nursing can develop blindness, sores on the scalp, and other infections. So ways to prevent getting gonorrhea is being abstinence, which is a method that is 100% effective in preventing pregnancy and infection as long as all sexual contact is avoided, including vaginal, oral, and anal sex. Always using condoms during sexual intercourse, and also having a sexually monogamous partner who doesn't have an infection reduces your risk of having gonorrhea. But if infected with gonorrhea, you'll be treated with antibiotics. The first antibiotic that will be given is the ceftriaxone, which is an injection that will be given combined with the azithromycin or the doxycycline, which are both oral antibiotics. So with those combined, it should resolve within days to weeks.
HIV is a virus that attacks cells in the immune system, destroys white blood cells in the immune system, as well as makes copies of itself inside the cells. HIV stands for human immunodeficiency virus, and it cannot be transmitted through sweat, saliva, or urine, but rather semen, blood, vaginal fluids, or breast milk. AIDS stands for acquired immune deficiency syndrome and has a set of symptoms caused by HIV. You can receive it when their immune system is too low or too weak to fight off infection and has develops certain symptoms and illnesses. Without treatment, AIDS can lead to death. Symptoms of HIV include fever, headache, rash, and mouth sores, swelling of lymph nodes, and fatigue, weight loss, shingles, or oral yeast infections. AIDS symptoms include night sweats, unexplained fatigue, skin rashes, unusual spots on your tongue or mouth, and a recurring fever.